One of the ways that we as doctors can diagnose SI joint pain is to perform some maneuvers in the clinic called provocative tests that place stress on the joint to replicate SI joint pain. Some of the more common provocative clinical exams for diagnosing SI joint dysfunction resulting in SI joint pain include the Gaenslen test. With this test is we're actually going to have the side that's affected, hanging off the edge of the table, and we're going to apply a downward force and a rotational force across the joint, to see if we can replicate the pain in that joint, Unlike the other tests, this test specifically creates a rotational force across the joint. So I need you to have you come over to the edge of the table. And the key to this test is really to have the joint off the edge of the table. And what we're going to do is we're going to let this leg hang, So it gives us a plane where we can actually rotate the joint through, I'm going to bend this leg, And I'm going to apply a force that pushes out on this knee and down on this afflicted joint, creating a rotational force across the joint, Do you feel pain over there?
I do.
Okay. The FABER test, or the flexion abduction external rotation test. For this test, I need you to make a figure 4 with your leg, In this case, we're going to be testing the left side, I'm going to apply some pressure to your hip, on your right hip, and I'm going to push downwards on your left knee. Is that where you have your low back pain off to the side?
Yes.
Does it radiate down your leg?
Yes.
Perfect. The thigh thrust. I'm going to have you bend your leg here, It's the same concept. What we're going to do is we're going to be applying a downward force through your SI joint to see if this replicates your pain, It's a constant force where we push down on your knee, straight down perpendicular to the table. Do you feel that?
I do.
And the compression and distraction exams. For this, I need to have you lie on your side, We're going to have you lie on your right side, And typically what I do is we put the afflicted side up, and there's a couple different techniques for doing this. You can actually do it either way, My preference is to have the afflicted side up. And I'm going to apply a constant downward force, pushing straight down through your SI joint to see if we can replicate the pain, Do you feel anything?
I do.
Perfect. The next test that we're going to do is sort of the converse of the compression test, called the distraction exam, And what we're going to do is we're going to apply force to distract over the joint to see if we can replicate your pain. The concept is to apply force going outwards, So we're going to apply some force going outwards, like that, Does that create pain?
It does.
The key with this test is to make sure the force is going outwards and not necessarily pushing down. If you have at least 3 of these tests which are positive, there's a good likelihood you may be having pain that's originating from your SI joint. And you may be a good candidate for some of the treatments that are out there for treating SI joint dysfunction.